Hey future RNs! Are you getting ready for your clinical competency assessment to get your RN license in Manitoba? Well, this video is for you. I'm going to break down the key areas you'll be assessed on, so you can go in with confidence and ace that exam. Let's get into it. First off, congratulations on making it this far in your nursing journey. You are about to take your Clinical Competency Assessment, or CCA, and it's an essential part of becoming a registered nurse in Manitoba. But what exactly are they going to test you on? Well, let's go over the key areas. First up, we have ambulatory care. You'll need to demonstrate your ability to care for patients who aren't admitted to the hospital but still need treatment. Think about managing chronic conditions, patient education, and creating care plans that can keep people healthy on the go. Pro tip: be ready to show your ability to work independently and help patients with self-management strategies. Next is mental health. You'll be assessed on your skills in managing patients with mental health challenges. You'll need to know how to provide compassionate care, handle crises, and work with mental health professionals to deliver comprehensive care. Remember, compassion, active listening, and understanding are key. Then, we've got community health. Here, you'll be working to promote health and prevent disease in the broader community. You might be asked about working with vulnerable populations, managing public health initiatives, and teaching patients how to stay healthy in their everyday environments. Next up, obstetrics. Expect to be assessed on prenatal care, labor and delivery, and postnatal care. You'll need to demonstrate knowledge of maternal and newborn health and be ready to provide safe, evidence-based care during childbirth. Pro tip: brush up on the stages of labor and newborn care. Emergency care is another big area. This is all about your ability to handle life-threatening situations. You'll be tested on your assessment skills, critical thinking, and your ability to make fast, informed decisions. Think trauma, cardiac arrest, strokes, and more. Be prepared to act quickly and stay calm under pressure. Next, we've got surgical and medical care. Whether you are in the or on medical or surgical unit, you'll be tested on your ability to provide care before, during, and after surgery, as well as managing medical conditions in hospitalized patients. Know how to manage post-op complications and work with the surgical team efficiently. Pediatric and adolescent health is another key area. Here, you'll demonstrate your ability to care for children and teenagers, including developmental milestones, vaccinations, and addressing emotional and physical needs specific to younger populations. Get familiar with age-appropriate interventions and patient communication. Next is geriatrics, caring for older adults. You'll be assessed on your knowledge of aging-related health issues and your ability to ensure safe transitions to the community or home. Pro tip: safe discharge planning and managing chronic diseases in older patients are huge in this area. Last but not least, palliative care. This is about providing comfort and care to those with serious, life-limiting illnesses. You'll need to know how to discuss advanced care planning and set goals of care with patients and their families. Make sure you are comfortable talking about end-of-life care and supporting families through difficult decisions. Now that you know the areas you'll be assessed on, here's the most important thing to remember: you've got this. You've worked hard to get here, and the CCA is just another step in your amazing journey to becoming an RN. Be confident in your knowledge and skills. Now that you know the areas you'll be assessed, join our CCA preparation classes. Get personalized, one-on-one training over 6 days, covering all the scenarios you'll be assessed on in the CCA exam. Sign up now to ensure you are fully prepared and confident for your assessment. Don't forget to connect with us, practice your skills with us, and take care of yourself during this preparation time. If you found this video helpful, make sure to give it a thumbs up, subscribe for more nursing tips, and share this with your fellow future nurses. You are not alone in this. Good luck with your CCA, and I'll see you in our preparation class.